Neck and back pain, let's talk about that today. I'm going to give you a protocol, a bunch of things that you can do, mostly on your home. Some of it is in the office, but I'm going to talk about 9 things that you can do for acute and chronic neck and back pain, mostly chronic pain because that's mostly what we see. Acute pain tends to go away. So that's what we're going to talk about here. I'm going to give you a series of 9 things that you can do. Remember now, medical disclaimer. Always talk to your doctor first before you're making any changes in your lifestyle, any nutrition changes, supplement changes, exercise changes. Make sure you get approval for your doctor before you're doing that. If you're going to increase your water, chiropractic, whatever it might be, let your doctor know, get approval before you're making changes. And of course, never make any medication changes unless you talk to your doctor first. Now, with that said, you also want to let your doctor know, who I'm sure will work with you about this, say, hey, I want to make some changes in my life. I want to make some changes in my nutrition and my exercise program and reduce stress and take these supplements and get more sleep and drink water and go see the chiropractor and so on and so forth. Let your doctor know this so your doctor can work with you, especially if you're under medication for a particular problem. It may be that your medications have to be tweaked. And in often cases, whether it be a diabetic medication or a high blood pressure medication or heart medication, these medications can be titrated down over time. So you want to let your doctor know that. As I get into these protocols, will these things work for many of you? Yes, they will. Will they work for all of you? No, of course not. And of course, we don't make any promises. I being a chiropractor, will chiropractic work for you? For many of you, yes. Some of you, of course, no. Will chiropractic be the answer for you? That's one of the 9 things I'm going to talk about here. Again, for some of you, yes, and some of you, no. Some of you might have to do 2 or 3 or all 9 of the protocols to get where you need to be if you have chronic neck or back pain. Will you need spine surgery? A lot of people will ask this in particular cases. Yes, some of you will need spine surgery. Now, myself as a chiropractor, we are trained to see if a condition warrants an emergency room visit immediately. And of course, if you have severe neck and back pain, particularly in the neck, if it's post-injury, if shooting, burning, terrible pain down your arm, or in the case of the lower back, if you have any bowel or bladder problems, either the inability to hold or not hold bowel or bladder function, that is a 911 call, that is an ER visit immediately. If you have burning, sharp, severe 10/10 pain in your leg and it's weak, that is an emergency room visit as well. That's extremely rare, but these things do happen, so just kind of keep that in mind. We're also trained, if we examine somebody in the office and your condition is significant and serious, we will refer out for orthopedic, neurological consultation, spine surgery consultation, and so on and so forth. And some people need spine surgery, that is true. Will the protocols help prevent some spine surgery? Yeah, it probably will help prevent some spine surgery, but we don't make any promises, just keep that in mind. After spine surgery, can you do some of these protocols? Yes, but get approval from your surgeon and your doctor. And in my chiropractic office, we treat people post-surgery all the time. We just make modifications all the time. We do that, just like getting physical therapy after a surgery. We do find that obviously the more the protocols that you do, the more dedication you lean into these protocols, the more time that you give it, again, the better results you're going to get. Just mentioning myself, I have had chiropractic care for at least for 45 years now. I started as a child. Both my parents were under chiropractic care in the early 70s. They brought in the kids for wellness care. So my first experience with chiropractic was wellness and maintenance care as a child. I would go in once a month with my mom for tune-ups. Later on in my life, I've had off and on low back aches for 30 years. And my back bothers me with prolonged sitting. If I'm up and moving like I am now, my back feels great. If you make me sit for a while, longer car ride, my back bothers me. I don't have sharp, severe pain, but I get aches and discomfort. Okay? So what I've done through the years is I employ these 9 protocols as best that I can. I'm under maintenance chiropractic care. I do the spine stretches. We'll get into that in just a moment. And what I have found is with this great maintenance protocol that I am on, my back problems, my back is actually better now than it has been in some time. because I employ these protocols, I stick with them as best that I can, and I'm trying to prevent further deterioration of the spine as time goes along. I believe that focusing on ideal health and wellness is priceless. If we have our health and wellness, you can do anything that you want to do in your life. Your body's not slowing you down, making decisions for you. You can decide what you want to do with your life. Okay, here's our 9 things. The first 2 things are in-office care. The other 7 are things that you can do on your own. The first one, of course, is chiropractic care. So if you want additional information, I'm just going to touch on this. If you want additional information, go to my book, Happy Back. I talk about that on my website. You can go to Amazon. My book, Happy Back, is a nice user's manual on how to take care of your spine. Okay? Go to my YouTube page, and I've got many videos on chiropractic as well, chiropractic results that people have had with their children and themselves and the elderly, and what chiropractic is across the board. Okay? With chiropractic care, there's 3 phases. It's just like everything else. You can work out for a month and get a little results and stop. We call phase 1 of chiropractic care is pain relief care. Some people will come in, will work on their neck and their back. They get enough pain relief where they're able to go back to work, they're able to engage with their family and their kids, they're able to work out again, and they stop care at that point. It may be that down the road, because the problem wasn't fully addressed, that it could come back. Hopefully it doesn't, but it could come back. But at least phase 1 gets them back engaged into their life. Phase 2, if you look at somebody who walks in like this. So phase 1 is somebody walks in like this, right? And we work on them for a few weeks or a month or 2, and we improve their spine enough where they say, hey, thanks, doc, I'm feeling good. I'll call you when I need you. Okay? Chances are something might come back in the future if we're like this. Phase 2 of chiropractic is taking somebody who has these spinal dysfunctions that they've had for a long period of time and trying to get you to as near normal as possible. Improving the function, the structure, the alignment, the range of motion, employing these other protocols, getting you to near normal or getting you into the best shape that we can, your ideal health, whatever that might be in your point of life. That's phase 2. And of course, phase 3 is wellness care or maintenance care. After we've worked that car over that needed some work, now it's running great, now you get tune-ups. After we get your teeth back in order again and your gums and so forth, now you're going to do this home protocol, and now you're going to do this ongoing dental maintenance protocol. In the case of chiropractic, if you decide that you want this, after getting you to as near normal as possible in the best shape possible, you come in infrequently for tune-ups, just like you do for your cars. So there's those 3 phases. Again, you can consult my book, Happy Back, and the videos on my YouTube page. Number 2, the second in-office treatment that we have is laser, cold laser. I have a class 2 laser in my office, so it's non-thermal. It doesn't generate any heat. It's very, very low power. You can go to my YouTube page. I've done several shows here on cable. I have videos on my YouTube page. If you want to learn more about what is laser, what is this therapeutic laser, cold laser thing that he's talking about, go to the YouTube page. You can check out the videos. I talk about cases and how it works. I've had 1 laser in my office for 16 years. I got a 2nd laser. They're very low power, as I mentioned. We're talking 5 to 7.5 milliwatts, so more than 1,000 times less than the lights over me right now or your light bulb at home, thousands of times less than that. The only contraindications to the laser that I have, the non-thermal, low-level laser that is, other lasers you have to have other protocols. But the lasers that I have is, number 1, don't shine it in the eye. I think everybody knows that. Number 2 is active cancer. Can't use it on active cancer. And number 3 is pregnancy. Other than that, you can use the laser everywhere in the body. I even have brain protocols, and I have an awesome video on my YouTube page on a concussion case in a man in his 70s who fell and knocked himself out, and he was struggling for weeks at home. And we did the laser thing, fixed him up pretty well. So you can check into that. Just as a reminder, there are 21 FDA approvals in the United States for using low-level laser on humans. 18 of the 21 were written by the company that made the laser that I have, Ergonomics. Again, you can read about this on my website and YouTube videos and so forth. So there's plenty of FDA approvals. One of the approvals is, by the way, for chronic neck and back pain, and that's what we're talking about right here. Another one is chronic musculoskeletal pain. That's another FDA approval for laser. The beauty of it is there's no downside. There's no downside. We can't hurt you with it, so that's kind of nice. And there's FDA approvals for plantar fasciitis. That was one of the first ones as well. And on it goes. So there's lots of applications for cold laser in there, okay? All right. Now, the next 7 protocols are things you can engage with at home. Of course, we talk a lot about it in the office. You can consult my book, Happy Back. You can go to the videos on my YouTube page for much, much more detail. My website has articles. So dig into all of that stuff. Again, that same reminder, don't start doing these protocols unless you check with your doctor first and make sure, particularly if you're under medications, you've got to check with your doctor before you're doing the nutrition changes and the supplement changes and the exercise changes. Talk to your doctor first. Okay. Number 3, nutrition. Eat the cleanest diet that you can enjoy. And I think that most people know what they should be eating. And if somebody says, you know, I'm not really sure, I said, well, let's think this through. Can you eat chips with reckless abandon? Most people say no. And then I'll say, what about broccoli? And they're like, yeah, that's pretty good. I'm like, you're almost there. Okay, so most people really kind of know what they need to be doing when it comes to nutrition. Sometimes it's not fun to eat the right stuff, but you know, that's what we do. And I have to say, this is such an unsung hero here when it comes to chronic inflammation and chronic pain. For people to understand, to make that leap that what we eat actually determines how much pain we may or may not have. It's a big indicator here. And I've worked with people in my office for over 30 years now. And when we make those tweaks in diet, it can make a really significant measurable impact on their chronic pain anywhere, but particularly neck and back pain as we're talking about here. Now, here's one thing that I haven't talked about enough. I'm going to be talking more about this. And thank you for Dr. Peter Attia. Dr. Peter Attia, he is a medical physician. He's a longevity expert, and he has a great website and a great blog. Excellent guests come on and so forth. One of the simplest changes that he talks about making, he suggests making, is something called intermittent fasting. Now, when I say that, I don't mean, oh my gosh, now I'm not going to eat for 3 days. Forget that. I'm not going to do that. What I'm talking about is time-restricted eating. Okay? Now, back in the 70s, as they were talking about on one of his podcasts, is back in the 70s, we almost like had this time-restricted eating. Would wake up and then would have breakfast at 7 or 8 a.m., and then the family would gather at home and have dinner at about 6, and then that's it. You wouldn't eat again until breakfast. So you kind of wouldn't eat for 12 or 13 hours, something like that. It's called it 12 hours. Unfortunately, in this day and age, we have longer work hours, and food is all around us, and it's usually things that are bad for us, but it's thrown at us 24/7. So the moment we wake up, we're eating, and we eat all the way to bed. So we might eat from 6 a.m. to 10 p.m. So now we only have this 8-hour period where we're not eating, and that's a big struggle for your body to be able to process fuel and the insulin responses and the inflammatory responses and so forth. So for some of you, let's say you're eating from 6 a.m. to 10 p.m. and that you restrict that from to narrow that down just from 7 a.m. to 6 p.m. Okay, so you only start eating at 7 a.m. and you stop at 6. So now it's a 13-hour period of time from 6 p.m. to 7 a.m. that you're not eating. Let's say you don't even make any changes in your food selections. You just make that change of when you're going to eat. That can really make a massive difference in people's inflammatory states and how much pain that they have, the stress on the heart, the liver, the brain, the cardiovascular system, and so forth. Look at that. See if you can pull that in. The best way to start to pull that in is increasing the time that you would spend between the last time that you eat and when you go to bed. Okay? So instead of having a late dinner, nudging that sooner, or making dinner not the largest meal, making lunch the largest meal, and not snacking after dinner and so forth. I've talked about this in many, many other videos, so that can really help. That's number 3, is a nutritional thing from a standpoint of chronic neck and back pain. Number 4, supplements. There are a variety of anti-inflammatory supplements that are available that can really help people. I have a lot of experience with this, working with thousands of people that come into my office with chronic pain, chronic neck and back pain in particular. And when we've done the chiropractic thing and the spine stretching thing, and we're looking for more improvements, we might work on the anti-inflammatory supplement routine. Again, you can look at my YouTube page for more information on this, mention things in my book, Happy Back, and of course my website has articles. You'll see that in just a moment. Okay. So we talk about, the first thing I do is talk about the omega-6, omega-3 fat ratio. Okay? Omega-6 to omega-3. Omega-6 are the bad fats. Omega-3 are the good fats. Omega-6 are inflammatory fats. Omega-3s are anti-inflammatory fats. Omega-3 is, call it fish oil. There are other omega-3s. I don't have time to get into that, but here we go. I think people should know that ratio. And that ratio, probably 120 years ago, was about 1 to 1. If you're 4 to 1 omega-6, omega-3, that's still the safe zone. When you get to about 15 to 1, you're in the really risky category. The average American now is 25 to 1. 25 to 1, omega-6 to omega-3, inflammatory, anti-inflammatory. I've tested many, many people in my office. I do it with a little finger prick. The worst I've seen is 30 to 1 in a 10-year-old. 30 to 1. That's not good. That's going to be a big problem. And so we did some work to turn that child's nutrition around and exercise around, and of course some supplements around as well. So that's the worst I've seen. The worst I've heard of from another colleague of mine, a chiropractic colleague of mine, is 70 to 1 is the worst I've ever heard. That's terrible. And that person responded really, really well. I've mentioned this before. It's worthy of mentioning now, unfortunately, with recent news here in 2021. Dr. Mark Hyman's book, Eat Fat, Get Thin, page 124, he talks about Dr. Hibble increasing linoleic acid, which is an omega-6 fat, inflammatory fat, bad fat, mostly from soybean oil, again it's omega-6, in the diet from 1960 to 1999 in 5 countries studied, predicted a 100-fold, 100 times increase in the risk of homicide deaths. Not only do these omega-6 vegetable oils result in more heart attacks and obesity and cancer, but they can make people murderers. Sorry to say that, it's just quotes out of this book, Dr. Hibble stated, again, increased linoleic acid, the omega-6 inflammatory bad fat, in the world over the past century may be a very large experiment that have contributed to increased societal burdens of aggression, depression, and cardiovascular mortality. It is likely that most of the diseases of modern civilization, such as major depression, heart disease, and obesity, are linked to the dramatic shifts in fats from the omega-3 anti-inflammatory good fats to the omega-6 warm weather oil, vegetable oil, cheap, subsidized bad fats. Increasing omega-3s in all of us may result in substantial decreases in healthcare costs by reducing expensive chronic diseases, including chronic neck and back pain. Okay, next supplement. Get your vitamin D level checked and know what it is. Most of your doctors are now are testing it regularly on your blood tests. Depending on the units used, and if you're not sure, you have to look carefully at your blood test. Make sure that the units are nanograms per milliliter, ng/ml, and the ideal zone is 50 to 70. 50 to 70. Most people that I see tested are in the teens or 20s or 30s. It's too low. You got to get it near 50. 50 to 70 is where you want to be. Okay? So get your vitamin D level checked. I've got articles on my website, by the way, and I've got some more videos on vitamin D as well. Next supplement, you can take a blend of antioxidants. Antioxidants are anti-rust. They fight rust in the body. They fight inflammation of the body. There are a variety of rust-fighting supplements out there. B-complex vitamins, vitamin C, CoQ10, alpha-lipoic acid, N-acetylcysteine, glutathione boosters, and so forth. I have a supplement that a lot of my patients have been taking, myself included, over 20 years, which basically has everything I just mentioned in one tablet. So you take one of these tablets per day. It helps protect oxidation of omega-3 fish oil, and it helps pull and activate those anti-inflammatory, antioxidant pathways in your body as well. Magnesium, I've talked a lot about magnesium. I've got videos on that. You can go to my website on that. Magnesium is really important. Here's another thing from an inflammatory standpoint, from a chronic pain standpoint, and a restless leg standpoint, and a heart arrhythmia standpoint. I recommend, this is my opinion, check with your doctor first. My opinion, don't take calcium as a supplement. Don't take calcium as a supplement. And if you want more information on this, go to my YouTube page and watch the video, Calcium? Ask an Elephant. Great little video, just a few minutes long. It's funny, but it's serious. Great message in there. There are other anti-inflammatory supplements. Some of you might already be taking these, are familiar with them. Curcumin, resveratrol. Curcumin is from the active ingredient in turmeric. Resveratrol is the active ingredient in red grapes that you've heard about. There are many supplements that combine those in one. You've heard of glucosamine, chondroitin, and MSM. There are many supplements. I have one in my office that combines those three of them. It may help some people with joint inflammation. It has been seen to help people rebuild some cartilage as well. So you can look at those. It works for some people, doesn't work for others. Glucosamine, chondroitin, and MSM. So those are anti-inflammatory supplements that you can try. Next up, number 5, exercise. I'm talking about now general physical exercise, more in spinal stuff in a moment. Just general physical exercise. Now, you've heard me say this before. I do not recommend exercising every day. Only exercise on the days that you eat. Now, I have a variety of videos on my YouTube page, and my book, Happy Back, talks about this, and so forth. Exercise is a general concept. It makes sense to everybody, right? Move your body. We sit too much. We don't move our bodies enough. And with Corona jail that we had over the past year, people were sitting even more, and the exercise routines fell apart, and gyms were closed, and all this kind of stuff. So people were just falling apart, right? Luckily, chiropractic remained as essential care from the beginning, so we were able to patch people together and help a lot of people out with this kind of stuff. Okay? But exercise. Now, walking is good. It's a good start. But if you can do some resistance exercise, if you have the capability, then do that. If you are not fluent on what to do when it comes to resistance exercise, whether it be bands, balls, body weight, dumbbells, whatever it might be, if you're not fluent, get help. Resistance exercise can be very beneficial for the body and very beneficial for the spine, particularly when we do posterior muscle work, back of the body muscles. If we do more of that work, it's going to be more successful than doing front muscles in here. I talk about that in my book, Happy Back. I talked about that in my videos. I talk about it in my office. Okay, so we do more of this and less of this, right? But in addition, I see way too much avoidable injury of necks and backs by doing the wrong exercises for a particular individual, going too intense in the beginning, trying to keep up with people, and so on and so forth. So if you're not fluent on what you should be doing, get help. Definitely get help. Okay? Number 6, spine stretches. So specific spine stretches. I've talked about them for 300 years on this show here, and I've got videos on them, and of course it's a big part of my book, Happy Back, and you'll see it on my website, and in my office we talk about it a lot. So spine stretches, at least twice per day. Look at your dogs and cats when they wake up. They stretch their spine, right? That's why we call it down dog, right? So animals have got that figured out. They're stretching their spine, right? So one of the mistakes that I see that people make is when we're working on their chronic neck and back problem and we make some gains and they're feeling good, they stop doing the exercises. One of the things that I do to try to link that together is I say, when you brush your teeth in the morning, stretch your spine. When you brush your teeth at night, stretch your spine. And they take about for the spine stretches that I teach, they take about the same amount of time. Minute and a half on your teeth, minute and a half for your spine, we're good. In the morning and the night, we're going to do pretty well. Some of you might need more of that because you have more of a chronic condition, or you're sitting all day long, so you have to take more frequent breaks. We talk about the breaks. You've got more video support with me. We have in-office support, my book, Happy Back, and so on and so forth. Spine stretching. Number 7. Ergonomics. This is super important. Ergonomics. Now, when I use the word ergonomics, I'm talking about how you use your body just in your everyday activities. How you move, how you bend, how you lift, how you do housework, your workstations, how you work out, what you're doing when you're sitting, how you're driving. all of these positions and activities. Yard work. If we go out and then we rake in one position for 4 hours in the spring and the fall, and we wonder why we busted up our back or inflamed our neck or our shoulder or our hip or whatever, because we didn't pay attention to this, we did it all at once, and so on and so forth. I have a woman that's coming in to see me right now, and she's got neck, back, shoulder trouble, and she will go aggressively after that homework, the housework, right? So she will vacuum the entire house all at once and the stairs and so forth, and then she's broken and busted up, right? So literally, I've got a couple videos on vacuuming on my YouTube page, and I've done them here on this show. So check those out. They'll help you. And what we did with her is we broke it down. I said, okay, do this. Vacuum one room per day instead of every week the entire house. She said, okay, I can do that. And I said, instead of 4 loads of laundry all crammed in and you're lugging it down the stairs like this all at once, right? Because we're always in a rush. And then cramming that in and yanking with all your might, getting those wet clothes out of the washer into the dryer, and then scooping out 9 loads and going up 8 flights of stairs and so on and so forth, and then you're all busted up. I said, how about 1 load a day? You know, something like that. She's like, okay, yeah, I can do that. So we had to change that whole concept of breaking up that ergonomic scenario with her. I mentioned yard work. You have to look at sweeping and shoveling and trimming and cleanups and so forth. Working around the house. Workstation alterations can be massive. One of the great ergonomic things that I talk about a lot, specifically with Corona jail, is a lot of people were now sitting more. They were sitting at home. They were sitting with makeshift workstations that weren't working. A lot of people were on the cushy couch with the laptop. And then people with school-age kids were then doing their work at home and then being part-time teacher to get the kids going, sitting more with them as the kids were on the Zoom calls and all that kind of stuff. And I agree with Dr. Zubin Damania and Dr. Peter Offit, Paul Offit, that did a video in December of 2020. And Dr. Paul Offit is a vaccine guru, and the two of them were very much into this and safety protocols and so forth. But they said, get the kids back to school. Get the kids back to school. Kids are not vectors for this. For COVID-19. I agree. But anyway, so you can check out, I've got videos on that and so on and so forth, getting the kids back to school. And that will get you into a more regular routine that everybody's used to and so forth. These are the kind of ergonomic changes that I'm discussing that you can really take action on and make a difference. And the thing about the sitting that I want to talk about is not only a workstation change, but as I talked about, even with the patient yesterday on the telephone, I said, you can have the perfect chair. You can have a $2,500 work chair that is custom molded with all these changes that you can make to the chair and all these knobs and contraptions and so forth. Nothing beats getting up and moving, getting up and moving, getting up and stretching. So more frequent stretch breaks, even if it's 30 seconds every 30 minutes. That's the timeline that I give people. Take a 30-second break every 30 minutes to get up out of the chair and do some stretching. Go for that brief walk and the spine stretches that I talk about here. Ergonomics. Number 8 is sleep. I have a great video. If you didn't see my show on this, you missed the video, go to my YouTube page. I've got a great video at the end of 2020 on sleep. Sleep is such an important part of repair and restoration as the body mends overnight. So getting enough sleep, getting restorative deep sleep is so important. And I lay out in that video a list of things that you can do for sleep. And there was a great book, Why We Sleep, that I talk about in the video. So, check that out. And there's a great list of things. Dr. Mercola's got a great list of sleep recommendations on his website. So check that out. Restorative sleep is so important with this. You get more and better rest, and you're going to have less pain. You're going to have less inflammation. It's just great for all tissues in your body and all of your organs. Number 9. So there's your 8 things that you can do, right? Now we're down to number 9. And I just dealt with this, consulting with a patient this morning before I came in to do this show. Number 9, chronic stress. Chronic stress, not acute stress. I'm not talking about you slipped but didn't fall and your heart races and you breathe and you sweat a little and stuff like that. That's acute stress. It's there and it's gone. The deer is feeding. Here's something in the woods. Simon Sinek does a great job on doing this. hears something, runs away, 15 minutes later, 10 minutes later, whatever, it's eating again, forgets about it, the stress chemicals go away. That's acute stress. Body can handle that. It's the chronic drip of stress. That chronic drip of stress is chronic inflammation. Chronic inflammation is going to lead to more chronic pain. And I know from thousands of people that come into my office, for a lot of people, chronic stress is at least a contributor to their problem. So if you've done all of those other 8 things that I talked about and you're still having some trouble, spend some time and focus and dedication and concentration on this portion of things. It will be well worth your time and effort. I have a great video on it. I have a handout on it on my YouTube page. It's in my book, Happy Back. Reducing chronic stress, implementing strategies on how you can reduce this will go a long way to improving all aspects of your health, all organ systems, and your brain and your heart and your longevity and your quality of life, but also reducing chronic pain, chronic neck and chronic back pain as the subject matter here is. It will go a long way in doing that. A simple thing that you can do is, as a lot of people have suggested it, and as I do, turn off the poison. Turn off the poison. The poison being news in general, media in general, but news. Don't just drone that news at you all day long because it's all so negative. I'm not saying be ignorant of the news and listen to none of that. I'm not saying that. But you need to have it on all day. I mean, I learned from Earl Nightingale. He was talking about this 50, 60 years ago. He said, when he was talking about television, he said, Americans have a TV set that's on all day. He was saying that like 60 years ago. Okay? And now we have it on, and now it's all this negative stuff. And he would say, imagine what people could be doing with their time. So my suggestion to you is, if you're driving around in your car, even doing errands, or if you have a commute, or both, make your car a drive time university. Start to put on constructive, joy building, encouragement building, enthusiasm building. It could be thought-provoking, personal development, stress reduction programs, audiobooks, whatever it might be. Start listening to that. I do that in my car all the time, and I don't even have much of a commute. But just driving around doing errands and whatever I might be doing, that's what's piping into my car all the time. And I really think that replacement of the poison that mostly is out here on there, building your brain up, putting a bunch of good stuff in, taking something from Tony Robbins, as he says, I just kept on dumping a bunch of good stuff in the hope that over time some good stuff would eventually come out. And I agree with that. Let's start building up those, what we're programming our supercomputer with good stuff in, and eventually good stuff will come out. And dealing with that, whether it be prayer, meditation, and these other programming methodologies that I'm talking about here. Start changing, make that shift in there, as Wayne Dyer likes to talk about. Make that shift into programming yourself with good stuff. That can go a long way in dealing with lots of health issues, decreasing inflammation and decreasing chronic pain. Okay, so that's the 9 protocols. Now, I'm going to take a few minutes at the end here, and I want to talk about what causes, what in your body, what in your spine is causing chronic neck and back pain. For the most part, it's not bone, unless you break them. And that happens, but that's kind of rare. I've had some slips and falls where people do break things, and got to send them out for x-rays. Okay, you know, you're not working with me until the fracture happens. So it's usually not bone. It's rare. You can, obviously somebody can have cancer, and cancer can go into the bones of the spine, and that can cause chronic pain. Not as common, not as common. And it's mostly, although the muscles are involved, muscles are not the source of chronic pain. So what I'm getting at when I say muscles is, if you hear of an athlete that pulls a hamstring or injures a quad or whatever, they might miss some practices or a few games, and then you typically don't hear about it after that. But if a professional athlete injures a neck or a back or a shoulder or a hip or a knee, whatever, they might be out for the season, right? So the joint injuries tend to have more of a chronicity to them as opposed to an isolated muscle injury, okay? In the neck, you've got a couple of structures that cause more chronic pain. And this is what I talk about with anybody that comes into my office that's new to me or if they have a flare-up. In the neck, it's usually a combination of irritation to the discs and the joints. Now, the joints are on the back side of the spine. They work like knuckles. They allow us to move around. So the knuckles in my hand are similar to the joints in the spine. Okay? The discs are the cartilage pads in between the bones, like the cartilage in your knee. It's that cartilage pad in there, and that's what's irritated here as well. Now, I'm choosing my words carefully. Disc irritation. I did not say disc bulge or disc herniation or disc prolapse or slip disc. Some people can have those things and some don't. But a disc irritation. Now, mostly on X-ray, you cannot diagnose joint and disc injuries. You can do it to a certain extent. If you're doing a variety of neck X-rays and you see some instability in there, then you know the ligaments are damaged and so forth, particularly after whiplash and other sports injuries. We can look at that. But you can't see, let's say, a disc bulge or herniated disc on X-ray. Only an MRI does that. Sometimes on clinical examination, we can make that call. And if it's more severe, maybe we need X-rays, MRI, and so forth. Okay. But I will often give people the diagnosis of a neck problem: disc irritation, joint irritation. Notice I did not say muscle. Now, we're going to use the muscles. The muscles are involved, and we can press on muscles, and they're tender, and they hurt, and so forth. But they're not the cause of the chronic pain. In the back, it's a little bit different. In the back, it's almost always the discs. Disc irritation. Now, I've seen this happen. I remember a 30-year-old man came in. He had off and on back pain for a couple of years. I gave him a diagnosis of disc irritation. His doctor ordered an MRI. I said, I really don't think you need an MRI, but whatever, there we go. Sure enough, he comes back. The MRI came back completely normal, perfect and beautiful, but my diagnosis stayed the same. Even though the discs look completely perfect on MRI, I said, you still have disc irritation. That is the source of your pain. It's not bone, it's not muscle, it's not nerve. It's irritated disc, even though the MRI was fine. Now, of course, a lot of the time people will have an MRI, and their MRI might show a disc bulge or disc herniation. And don't forget, I really love quoting that study where researchers grabbed 100 people off the street with no back pain and no history of any back pain. And they said, and they did MRIs, low back MRIs on these people, and close to 50 of them had disc problems in the lower back seen on MRI, disc problems, disc bulges and herniations and degeneration and arthritis and wear and tear, but they didn't have any pain. So the take-home message there is you have problems first. Problems first. You have wear and tear and misalignments and irritation and wear and tear first. Pain last. And that's the idea here. The simple analogy is you have a brand new beautiful car, you thump a curb or you hit a pothole and you knock it out of alignment, but everything seems fine. It's silky smooth down the highway and it's running perfectly. And then 6 months or a year later, it's starting to shake down the highway and squeal around the corner. You bring it in for a tune-up and they look at it and they're like, oh yeah, your tires are all worn, your tire is all worn down and your front end parts are worn down as well. You're like, what happened? The symptom just started last week. And they would explain, well, you've had this wear and tear process that's been going on for some time unannounced. That's what happens here in the spine. It's that chronic irritation, inflammation, lack of upkeep, and so forth. And then from the side, we have this scenario here, right? So this posture with text neck, a real phenomenon. How does that work? 12-pound bowling ball, little tiny neck, pull it forward like this 8 hours a day in the case of teenagers on their phones, right? Imagine this. Go to the gym, get a 12-pound dumbbell, hold it here all day. Oh, can't do it. Take that same 12-pound dumbbell, hold it here. Much easier, okay? So simple lever from physics, right? Here, more difficult, more wear and tear, right? More wear and tear. In the center, the teeter-totter, much better, much nicer. Texting here for 8 hours a day. We will see, unfortunately, ramifications, and we already are seeing the ramifications of that in the younger generation coming up. Same thing with computers. Back we talked about ergonomics. Ergonomics, workstation, taking breaks, stretching, or ergonomics. So a slow wear and tear process over time is what causes these joint and disc irritations in here. But that can also be coupled with injuries. Some people will come to me and say, well, I've never had an injury. I said, were you ever a child? Right? And they're like, yeah. And I said, did you go sledding and crash? Did you ride a bike and smash? Did you play sports? Did you? So injuries and traumas and irritations which can knock things out of alignment, and then, but there was no pain at the time, let's say, but 20 or 30 years later, then they come into me and say, I don't know what happened, I never injured myself. And I said, yeah, likely you have, but you didn't know it. And then there were some irritations over time that happens with that, and that causes that chronic thing. So what happens is somebody will come in, we start to work on them, and most people respond, some don't, but most people respond, and then we make a little bit of a change and they feel better, and they might stop coming in at that point, but then they'll come in because it became flared up. And that's when I talked about that phase 1, 2, and 3. Phase 1 is, I feel better, thank you. Phase 2 is, let's get them as good as they can be. You know, if somebody's 85 years old and they're like this, probably not get them here. I have a 96-year-old man coming in right now. He's 96, walks right in, here he is. I'm actually working on his knee, right? And his spine is pretty good. Of course he's like this. The goal with him is not to get him here. The goal is to just improve his quality of life. But if somebody's younger, we can go after this kind of stuff and try to get you to as near normal as possible. And then, of course, that phase 3 is to get you as well as we possibly can. Now, keeping in mind, too, that if you bring your car to the mechanic and they say, the tire's out of alignment and the front end parts are worn down and stuff like that, we can't just put air in the tire and then think that that's going to take care of things. It's probably going to take more work to get things lined up and straightened out and to get that car to as near normal as possible, okay? Another example would be you've got a hole in your muffler and it's really loud, right? Bring your car in and they put a patch on the muffler. They're like, oh, whew, that's much better. Okay, and you drive away. A month later, the hole comes back because it was only a patch and now it's really loud again. So to get in there, you're going to go in and you're going to go to phase 2, which is repair the parts that need to be taken care of. And then, of course, phase 3 is maintenance care on the car. Same thing here. You know, we're trying to take people with whatever amount of care that you want. But not only is it the chiropractic care and maybe the laser, but it's the other 7 phases or 7 protocols that we put on here. And I introduce these things to people over time. That's why we're talking about here. That's why there's a little bit more detail on what's going on with the spine, what causes these acute and chronic neck and back pain scenarios. If you need more information, go to my website, drscottfuller.com. Go to my YouTube page, just put in my name into YouTube, and then you can search there, and I've got a couple of 100+ videos on there. And just check out the videos. And of course, my book, Happy Back, has a lot of information there as well. Hopefully you got something out of it. I'm Dr. Scott Fuller. Thank you.